So the importance of prevention, particularly in the context of healthy aging, has really risen up the global agenda over the last few years. Be that sort of the UN, WHO's Decade of Healthy Aging that we partly fed into, to national governments putting forward prevention plans and strategies. But we know that, while there is a lot of agreement on the need to invest more in prevention rather than just treatment and cure of diseases, and that there are lots of solutions out there that really work and could be really cost effective. We know that the actual sort of real-term investment is still very low, and that action really has been lagging behind sort of commitments for a really long time. During COVID, we've seen governments really step up to the mark, invest more in preventative services like immunisations, for example, and really created the infrastructures that are needed to deliver them. So from really good health messaging, thinking about people at the centre, trying to tackle inequalities and things like uptake of vaccines, and putting preventative interventions right at the heart of communities. But the important thing is that we make sure we're sort of following up from that. Despite really big government investments during the pandemic, we're actually further behind than when we started, with really big health tolls on people, health inequalities worsening, and things such as long COVID that will really have long-term effects on the health of our population. So rather than stall now, we need to be doubling up investment, really sort of focusing on this, making sure that the infrastructures we've built during the pandemic, so be that good tech, better access to preventative health interventions and so on, that we're really building on them because we could lose them. With waiting lists longer than ever and a really big burden of disease, now is really not the time for inaction. We can't risk going back to business as usual.
Over the last 2 years, we've been undertaking a global program of work called Prevention in an Aging World, really understanding how we can get G20 governments to invest more greatly in preventative health and how they can actually deliver preventative health, how they can actually reorient their healthcare systems more towards prevention rather than cure. Over the last 2 years, we've been speaking to experts from across the world to really understand what the solutions are. And in our report and from our discussions speaking to these people, it's very clear that we need to do four things. We need to invest in systems designed for prevention. We need to inspire policymakers, healthcare workers, and healthcare professionals and individuals. And we need to democratize access, and we need to use technology more effectively. When we think about prevention, we really need to think about the systems that are in place for prevention. We need to ensure that countries actually put money behind what they're actually saying, investing more in prevention. So at least investing up to 6% of their health budgets towards preventative health, like Canada already does, and is an example of sort of a leader in that space. Investing more is only the starting point. We also have to ensure that countries have a national prevention policy in place that can actually so that countries can actually demonstrate that they're prioritizing prevention and they're looking at prevention across the life course and across various conditions. We also need to think about how we can better inspire and engage healthcare workers, policymakers, and individuals themselves. And this starts with better supporting healthcare workers' health, their working conditions. It's also about ensuring that we're involving all healthcare professionals, whether they're a nurse, whether they work in allied healthcare, in supporting prevention. And this could be through delivering vaccination, as we've seen during the pandemic. All healthcare workers have been involved in administering the vaccine. And it could be even just educating individuals and patients about their health. We also need to be looking at how we can widen access, so democratize access to healthcare. So we need to really be investing in tailored approaches, ensuring that no one is left behind. And we also need to invest more greatly into technologies that actually work for everyone. So whether that's actually, building off of what we've developed during COVID and having an online digital platform where we can actually bring health data together so that both patients and healthcare professionals can look at patient data and actually think about what's best for a patient. Whether it's actually having the right sort of processes in place at government level so that industries incentivized to develop technological solutions that actually are based on solving a health issue rather than potentially something that looks interesting or new or shiny. And it's also about ensuring that we actually focus our attentions not just on the newest types of technologies, but those that are actually low touch, low tech, so that people with disabilities, people from marginalized and underserved populations can actually access these technologies and benefit from them as well.
Over the last 2 years, the ILC has established itself at the forefront of the global prevention debate. We have informed the UN's Joint Decade on Healthy Ageing and the WHO Immunisation Agenda. We've also convinced G20 ministers in Japan to form a joint focus on prevention. So over the next 3 years, we've got a really exciting and ambitious programme which centres around what we're calling the Global Health and Wellbeing and Prevention Index. We want this to track progress and good practice around how we can tangibly deliver prevention. We want this to be used as a catalyst for change, a tool for governments and international organisations to think about how we can prevent poor health from limiting the contributions of an ageing population to society.